We are live, sir.
Ma'am, we are on live and we are starting the session, ma'am.
Okay.
Yes. So very good evening, doctors. I'm Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. The topic for today's webinar is, can stress make it hard to get pregnant? So I would like to welcome all the participants. I request them to post their queries, if any, in the chat box. So chat box will be open for us till the webinar is going on. Please post your queries there. And I would like to now welcome our invited speaker for the day, Dr. Santosh Somani ma'am. Madam has done her MS and MRCOG. Madam has done her reproductive medicine, and Madam has a very good, rich experience of 18 years of experience in the field. And Madam is currently the consultant at RPS Hospitals, Korattur, Chennai. So, ma'am, with this short introduction, I welcome you, ma'am. I'm handing session to you for your presentation, ma'am. Welcome, ma'am.
Thank you to Shield Healthcare. Thank you, Dr. Stalin, for the kind words. Can you upload the slides, please? Yes, coming to today's topic, can stress lead to infertility? Next. Infertility is on the rise. It is an epidemic. 1 in every 4 couples in the reproductive age group are having infertility. Also, about 10 to 15% of married couples are experiencing some fertility issues. The cause for infertility could be primary or secondary. And today we are going to analyze if stress leads to infertility or infertility leads to stress, who caused what. Now, what is stress? Stress is a natural reaction of the body and mind to face daily challenges. And the stimuli could be various. Next slide, please. As you can see, the parents are arguing, the child is stressed about that, or it could be a car breakdown, or it could be your routine occupational work, or it could be your grieving your beloved ones. So stress can be various. At the same time, we have to carry our reproductive function. So the type of stress could be psychological factors, which can manifest as fear, depression, or anger, or the physiological stress factors could be pain, injury, or an infection. Added to that, environmental stressors, which could be based due to occupation or due to diet problems, based on whether you are a little on the plumper side or too thin, and the social stigma associated with this. The diagnosis of infertility itself, people react various ways. So it could lead to psychological distress in the form of anxiety or depression, or it could lead to emotional stress, where the patient experiences a feeling of helplessness or feels that this is the end of the world. And men especially take up addiction like smoking or alcohol. It is also common in females. So emotional stress also can be there. Also, added financial difficulties, that at each step they are going to require more finances. They have to plan it accordingly. And the diagnosis of infertility, be it male or a female, has a negative impact on self-esteem. You start looking down upon yourself. For male, it is associated with loss of masculinity. And for female, because child is considered as an essential, having a child is considered as an essential part in a marriage, in the institution of marriage. So if you don't fulfill that particular criteria, you are looked down upon. Then most important is social pressure and social stigma. So it alters the relationship between partners, also family members and friends. When they give some meaningful suggestions, the couple or the female counterpart take it, don't tend to take it in the reaction normal way. So they tend to like sort of avoid crowd, especially when it is involving any gathering involving children or pregnant females. So slowly they tend to socially delineate themselves. Next slide, please. it has also been seen that whenever there is a history of depression, uh, those patients are likely to experience infertility to a more extent. Also, having anxiety may prolong the time needed to conceive. So, net result is they will be taking a long time to conceive. Also, when there are recurrent failure loss, or if at the starting of the treatment and as the duration increases, if we are not succeeding, then as the duration of years of infertility increase, the levels of stress increase. Initially, when the couple comes for the consultation, they are very hopeful that yes, this is a magic key, everything is going to work. But as the duration increases, because we know it is not just throwing a ring and you get the chance. If it clicks, it clicks. Otherwise, we need to proceed step by step to the next. So as the duration increases, the levels of stress is also increased among the couple. Next. This is an Indian study. It's a prospective study done to assess the mental health and quality of life among people undergoing assisted reproduction. I projected it because it's an Indian study. There are very many studies on the internet available. So they have come to a conclusion that infertility definitely has a detrimental effect, and it increases. They tend to have high levels of psychological stress, depression, and anxiety. So overall, the quality of life is also reduced. Next. So how does the stress actually help? See, in routine life, little bit of stress is definitely needed. Only then that will that will push us to achieve more. Otherwise, we'll be always in the comfort zone. So let us see how stress affects fertility. So it disturbs the hormonal pathway, the neuronal pathway, and also brain waves. So let's see each one. Next. So the hormonal pathway is the most common and popular hypothalamic pituitary ovarian axis. So whenever there is stress, there is excess stimulation of these hormones, and they will in turn lead to negative inhibitor feedback. So it ultimately affects the GnRH pulse generator. Therefore, the amount of LH, FSH secreted from the anterior pituitary, released from the anterior pituitary is reduced. And therefore, the steroids produced from the ovary or the testis, whichever reproductive organ, and that is reduced. As a result, in female, it leads to suppression of oocyte maturation, and ovulation is affected, as well as the likelihood of forming of ovarian cysts. Also, because of high levels of stress, there is increase in the prolactin levels as well. So prolactin, as you know, that also delays ovulation and results in lot of ovarian cyst formation. Once conception has occurred, and if stress continues, it also affects the successful continuation of the pregnancy. So it can affect the blastocyst implantation as well. We'll see in the subsequent slides. Next slide, please. So the general hormonal pathway, the hypothalamic pituitary adrenal axis, it gears us for the fight or flight response. So the corticotropin releasing hormone, that is the main stay of this axis. And this in turn produces normal physiological changes. However, in excess amount, it disrupts the signal of given to the ovary by again stimulating beta endorphins, and which will interrupt the GnRH pulse generator. And as a result, the following subsequent pathways are obstructed. So the connection between the brain and the ovaries, or brain and the testes, is disrupted, and as a result, we results in the infertility. Next. Of more interest is this corticotropin releasing hormone. Like I told, it directly inhibits the gonadotropin releasing hormone pulse generator. So as a result, there is a suppression of LH and FSH from the anterior pituitary, and this leads to decreased steroidogenesis. So oocyte maturation and the steroids production is affected. Also, it leads to a lot of sympathetic activity, and that formation that leads in development of formation of cysts, Added to that, the prolactin, high levels of prolactin. Next. There is also this popular progesterone steal theory. So wherein, whenever there is stress, the body tends to produce more cortisol. So pregnenolone is the basic substance from which progesterone, cortisol, all the hormones, and from thereby the testosterone, estrogen, all those are produced. So it is said that during stress, the pregnenolone specifically diverts all the towards cholesterol production. However, this is not entirely true because each mechanism of converting the pregnenolone to cholesterol or pregnenolone to progesterone acts at the respective organs, and that is dependent upon the stimuli. Like for cortisol production, ACTH is required, and for the same pregnenolone to convert to progesterone in the ovaries, the LH stimulation is required. However, during stress, it has been generally seen that the cortisol production is excess compared to progesterone production. Next. Next, coming to the neuronal pathway. This GNRS pulse generator that we talked about, that the neurons require GABA activity, gamma aminobutyric acid. So when that, so therefore indirectly that is required for spermatogenesis and oogenesis. Next. When there is during stress, there is increased glutamate activity. So thereby decreased GABA activity. And so indirectly it impairs the spermatogenesis and oogenesis. So all these help towards arriving at a solution for this, tackling this problem. Next, we talked about the brain waves. So the normal brain waves when we are relaxed is the alpha waves. When we go into deep meditation is theta waves, and deep sleep is delta waves. And when we are active, mindfulness is beta waves. However, when we are stressed, the alpha waves are converted to high beta waves. Next. So this is what I told. When there is a stress, the alpha waves, the relaxed alpha waves is converted to high beta waves. And so that also leads to a lot of change in the chemical production. Next. So these are the various studies. This study is on impact of stress on menstrual cycle. So in this study, they have seen that the subjects who have high level of stress had a lower level of estrogen and likelihood of anovulation. In fact, even more than PCOS, they are likely to have more of ovarian cyst, unlike PCOS, and leading to anovulation. Next. The next study is done to see the effect of stress and the time taken to conceive and what is the conception rate. So this they have studied by salivary alpha amylase, and they have come to a conclusion that people who have high levels of stress had high levels of alpha amylase, and they have 25% of these women had more trouble in conceiving. And there are further more studies coming subsequently to support the same theory. The next slide. So this is a study done on relationship between stress and IVF outcome, and the same stress biomarker alpha amylase that has been studied. And they had seen that this is a 2014 study. They had seen that those who had high level of alpha amylase had 20%, 29, around nearly 30% lower conception rate compared to people who had lower stress. And this study was done over a period of 1 year. Next. This is yet another study where the correlation between stress and IVF outcomes have been studied. In this study, they noticed that the people with high stress group, the participants had lower estrogen levels, higher risk of anovulation, and lower chances of pregnancy, all coming to the almost the same kind of conclusion. Next. This is yet another study which shows that high level of stress had lower level of conception. And those people who were less likely to conceive, they were this is vice versa. So those people who were less likely to conceive also reported having a high amount of stress. Next. So what exactly does this stress do? So the stress leads to a lot of reactive oxidative species, and also the increased cortisol leads to oxidative stress levels that probably causes apoptosis. So the granulosa cell apoptosis results in reduced estradiol synthesis in the ovary. Therefore, the growth and development of the follicular oocytes and is affected and results in oocyte apoptosis. Also, the apoptosis deteriorates the oocyte quality, thereby leading to poor reproductive outcomes. Next. So the effect of stress is not only on the ovary, the uterus, which is the end organ, which provides the endometrium, which needs to decidualize to act as the fertile ground for to receive the oocyte, is at the zygote. I'm sorry. So to receive the zygote and for implantation, that is also important. So stress also has an effect there. So what it does is it makes the endometrium non-receptive, and if implantation has occurred, it disturbs the early maternal fetal interaction, so thereby leading to infertility or loss, pregnancy wastage. Next. Now coming to male. So in male, the reaction to when you give a diagnosis of infertility, they tend to react a little different. See, they also have psychological stress, but male generally tend to compartmentalize their stress. So hence they are able to go on with their professional work as well. So psychological stress, not stress per se, but like in form of addiction or causing a lot of reactive oxidative species, that kind of thing, that leads to harmful sperm quality and affects the sperm concentration and their ability to perform the act, that is for ejection, ejaculation, all that, it has an effect. Generally, men who feel stressed, they tend to have a lower sperm concentration, and the sperm morphology is also tend to alter. Next. So this is the normal HPA axis pathway. So stressors act on the hypothalamus level, increase the corticotropin releasing hormone that acts on the adrenals and produces the glucocorticoids. Glucocorticoids act on the Leydig cells and inhibit the production of testosterone, which is essential for sperm production, spermatogenesis. So thereby spermatogenesis is affected. Also, the corticotropin releasing hormone affects the prolactin. So prolactin, if it increased in male, that also tends to have effect on the semen parameters. However, it is important to note that small amount of corticotropin releasing hormone is essential for normal reproductive function, both in male and female. It always happens when the balance is toppled off. Next. This is the hypothalamus pituitary ovarian axis and then the ovarian and the testicular axis. So hypothalamus, there are kispeptins and other biochemicals which tend to stimulate the hypothalamus, inhibit, and thereby the further production from the anterior pituitary of the GnRH, FSH, LH, all that is altered, thereby reducing the ovarian steroidogenesis and thereby having an effect on the fertility. Next. So there are various studies done on to assess the effect of stress and male parameters. So what can stress do to sperm quality? So this is a Danish study where they found that participants who had higher level of stress had a lower semen volume, count was low, as well as the morphology also seemed affected. Next. This is yet another study where they found that if the participant had stressful events, be it anything, loss of a grieved one, or you're grieving loss of your job, or anything, any stressful event, or even the diagnosis of infertility, you have tried for a year or so and you're not successful. So any more, 2 or more successful events within a year, within 12 months of each other. So that tends to affect the sperm motility and small amount in sperm morphology also, compared to those people who did not have any such events. Next. This is yet another study where 2 groups were studied, group A and group B, where an intervention was given. So whether to see if the intervention helped. So stress reducing therapy definitely had some improved the semen motility and count as well. So this shows an opportunity where we can intervene. Next. So stress per se, not stress per se, it is the oxidative, reactive oxidative species that will cause increased sperm DNA fragmentation. So whenever there is increased sperm DNA fragmentation, that will definitely affect the fertility. And also if in IVF we have achieved via ICSI, we have achieved a pregnancy, further the growth of the embryo is also further will be affected if there is a high sperm DNA fragmentation. Next. So this is way back from 2002 and then again in 2015, whether interventions, psychological interventions help. So in this study, cognitive behavior therapy and mindfulness has been suggested, and they have seen that the participants who had this kind of intervention had higher rates of pregnancy than who had just a normal course of pregnancy. Next. So having said so much, it is not that stress alone leads to infertility, but definitely we can come to a conclusion that the diagnosis of infertility can lead to stress. And there are various other reasons also why we would have stress. So it is important that we need to manage the stress. And while they seek treatment for fertility, it should be a side-by-side step. Next. So managing stress. So first is to manage the symptoms. You can suggest, first you need to identify the factors. And hence in the new ART bill, there is the need for counselors. So the role of these counselors is not only to assess their, they have to see whether they are physically, mentally, financially fit. And also important is whether they are able to accept failure and then go ahead with the next step. So all these assessment is important in the first go itself. And also it becomes important to assess intermittently, especially when there is no immediate success with the onset of treatment. So we can resort to exercise. No, previous slide, please. So to manage the symptoms, exercise, routine exercise is definitely important. Then the importance of yoga and meditation. So what this meditation does is the stress levels increase the the high beta waves, the brain waves that we had seen earlier. So it tries to bring to the alpha level. So thereby reducing the stimulators. So meditation does have an effect. Then cognitive behavior therapy. It could be individual or group therapy. And mindfulness. All these can help to reduce the stress levels. Also, psychotherapy helps in addressing anxiety and sleep disorders, depression. When once these are corrected, the patient tend to respond better. They they are able to take better decision making. Also, in a study, it was seen that when the female partner is accompanied by her husband, with her husband rather than any other family member, they experience lower level of stress. So hence, it would be a suggestion that whenever there is a counseling or whenever there is a consultation, it is better to involve the rope in the husband as well to as many visits as possible, so that the couple together will address this issue and the female partner is put at ease. Then also address other potential causes. See, it could be IUI, it could be IVF. IVF itself is stressful because they have to come at particular appointments, then the load of injections. Then once the egg oocyte is retrieved, how many eggs they're going to get, how is going to fertilize, and once the embryo transfer is done, and to the waiting period of 2 weeks, that is the most stressful period. They don't know if it's going to, all their money is going to be fruitful or not. So it is quite stressful. So it is important that we address at each level and ask them to journal their address. So journaling is a good way. They can write it down and they can talk it to the clinician or to the psychologist, whoever is there. And accordingly, when the solution is provided, that tends to sort of, or when they know that they have been listened to, that itself brings them a little peace and the levels of stress are less. Then we have to aim for a better work life balance and ask them to carve out small friendship groups, small groups, support groups, only those people who will support them, who will or give them a patient hearing, that is sufficient. And the work on strengthening the relationship between the couple, that will work in a long way. Next. This is yet another Indian study where they have seen, tried to assess the effect of stress and infertility and trying to intervene with yoga. So India is nothing new to yoga. So we need not say yoga to everybody, but that is a cheaper and easier supplementation along with the fertility treatment. So they have done the study at Delhi, MAMC Delhi, and they found that this government run IVF centers can greatly reduce the financial burden of the infertile couple and reduce their stress levels by introducing such kind of strategies, which is low cost, and it is overall not only a dream of parenthood, in other spheres of life also it will tend to reduce the stress, so it will help them. Next. These are other studies where psychological interventions like psychotherapy in patients with infertility have been studied and seen if rates of pregnancy are improved. And there has been marginal difference in the, it may help to, see, we cannot say it will totally improve the live birth rate, but yes, it definitely helps the overall approach of the couple to the treatment, and thereby it helps to improve the their psychological scale related to infertility and depression. And when their overall mental health is good, then definitely it increases the fertility rates as well. Next. So in managing stress, it is important that we insist the partner also come, and both the husband and wife should have a strong relationship and supporting each other. So that will go in a long way. And because that will reduce the cortisol level, which we have already seen that cortisol is having, excess cortisol is having detrimental effect in all the level, at all the levels of the hypothalamic pituitary ovarian axis, and thereby by reducing stress, these levels come down. Next. So this is a small picture showing all the stress relieving thing, like you don't feel alone, journal, try to nurture good friendship, and exercise regularly, get involved in yoga, and seek for help. Whenever you want, seek for help. That is important. Next. So with the studying the causative factors, the company has come down with the product which can help to reduce stress hormone levels by acting on the corticotropin releasing hormone. I would like to add that I do not endorse the product nor I have experience in using it. However, it is a good opportunity for us to try and use it and help our patients if need be. Next. So they have come with a product called as Oraspa, which is a capsule which contains lactium and L-theanine. Lactium is nothing but milk protein, and L-theanine is a content seen in green tea, helps in calming the mind. Next. So this is just a pictorial representation. Next. So giving lactium acts on the corticotropin releasing hormone at that level. And they have studied and seen that there is 25% reduction in the stress-induced cortisol level within 3 months of treatment. Next. So lactium acts by reducing stress-induced cortisol levels. So the GnRH pulse generator that is restarted, and that normalizes the FSH. So thereby the estrogen in female and the male testosterone that works, and thereby the oocyte release, oocyte quality, and the endometrium, everything which is dependent, estrogen dependent, all works well. While in males, it leads to normal it normalizes the spermatogenesis process and thereby helps in fertility. The next content of it is next slide. So lactin is non-sedative. It improves the GABA activity as well. Next. The next molecule is L-theanine. This is seen in green tea, like chamomile tea is suggested if you are stressed out and you're not able to sleep. You must have seen in movies. So this L-theanine, it reduces the brain activity, it brings down to alpha frequency. So thereby it normalizes and reduces stress. Next. So Oraspa, overall, it regulates the hormonal pathway and neuronal pathway by intervention at the GABA level, and also the brain activity, that is the alpha levels. So thereby trying to reduce the stress levels and hence may indirectly help with the fertility outcome. Next. There is no addiction or tolerance or sedation. Next. So to conclude, it is definitely, we can say that infertility, the diagnosis of infertility can be stressful to the couple and to the doctor till the patient conceives. So it can lead to anxiety, depression, sleep disorders, and different people respond to stress differently. So it can make stress makes difficulty in conception more for women than men. And so stress reduction techniques, when employed on regular basis, definitely help in conception rates. And all these stress reduction techniques are non-invasive, they're less expensive and ethically acceptable. And so fertility treatment protocols should initiate at the beginning of treatment and also at regular intervals for those people who are not able to conceive immediately. So the assessment has to be done at a regular basis and addressed then and there. So the profession in reproductive, thank you. Thank you. If there's any questions, I'll be willing to answer.
Yeah, ma'am. Thank you, ma'am. Thank you very much, ma'am. Ma'am, the recent statistics says that women struggling with infertility have the same levels of anxiety and depression as woman with this cancer and HIV, ma'am. So any couple who are going for this IVF treatment are much stressed, either as you conveyed, because of the treatment, because of the protocols, procedures, everything. They are just, their depression and anxiety levels goes up, and there is some need for drug or any supplement which can reduce the stress level, so that this increased cortisol level will be having a negative impact on this brain, ovarian and testis axis, ma'am. So there is a need, ma'am. Ma'am, thank you for conveying such a wonderful talk today, ma'am. Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am. Ma'am, we have one queries in the chat box, like whether it is safe in pregnancy, ma'am. Uh, the product Oraspa, whether it is safe in pregnancy, ma'am. As a company, let me answer this query, ma'am,
Yes,
because
you take the call
uh,
here.
yeah, ma'am. So there are many toxicity studies which has been done in this lactium and this L-theanine, which says that it is safe, and it is having this GRAS status also, ma'am. It is generally recognized as safe by US FDA. So it is available. It's a milk protein which is available in the chocolates and ice creams also, ma'am. It is in US. So it is safe, and it is safe to be used in pregnancy, ma'am. And ma'am, one more question: how long we have to use this Oraspa? So that is the question. Again, ma'am. Yeah, ma'am. It has to be
The study was done for 3 months.
3 months.
I have
Yes.
personal experience with the product.
Yeah,
It is
ma'am.
once a day, can be given to both the partners, and better at bedtime because it will induce better sleep,
Yeah, ma'am.
and can take it for 3 months, and then you can see the effect and take it from there.
Yes. And ma'am, more one, that is the stress level during embryo transfer is very high, and whether it can be used in those times during embryo transfer.
See, again, I don't have a personal experience,
Yeah,
but
ma'am.
going by the product, it is a milk protein, and L-theanine is seen in tea. So we generally don't don't take tea during your embryo transfer or anything. So I think there should not be any problem during embryo transfer as well.
Yeah, ma'am. So audience, if there is no other queries, then we can end the webinar for today. Is there any queries? You can just post in the chat box. So this webinar will be available in the YouTube. So you can use this video for your further reference also, and you can share among your friends also.
Are we concluding,
Yeah,
Mr.
ma'am.
Talent?
Yes, ma'am. Yeah, ma'am. There is no
Okay,
queries.
thank you.
Yeah, ma'am.
Thank you all
If there
for
is any
patient listening.
queries,
Thank
then I
you
will
so much.
forward to your mail ID, ma'am.
Yeah,
Thank
yeah,
you.
sure, sure, sure.
Thank you,
Thank
ma'am.
you so
Thank
much.
you, ma'am.
Thank you, thank you.